Hello again, and happy Saturday from Metro Manila, the Philippines, Southeastern Asia. During the last several months, Trump has probably lied tens of times about the COVID-19 pandemic. And here is a compilation of those lies. This article was published on the Atlantic.com website on August the 17th, 2020. On the nature of the outbreak. On Friday, February the 7th and Wednesday, February the 19th, 2020. The claim the coronavirus would weaken when we get into April in the warmer weather, that has a very negative effect on that and that type of virus. The World Health Organization says that the new coronavirus can be transmitted in all areas, including areas with hot and humid weather. Then, on Thursday, February the 27th, 2020, it's going to disappear. One day, it's like a miracle, it will disappear. The truth, Dr. Anthony Fauci, the director of the National Institute of Allergy and Infectious Diseases, warned days later that he was concerned that as the next week or 2 or 3 go by, we're going to see a lot more community-related cases. Then, multiple times, Donald Trump claimed that if the economic shutdown continued, deaths by suicide definitely would be in far greater numbers than the numbers that people were then discussing for COVID-19 deaths. Now the White House estimates that anywhere from 100,000 to 240,000 Americans could die from COVID-19. The death toll now in the United States stands at trying to locate it. Hmm. 185,272. Yes, 3,352,194 have recovered, but still the death toll is rather high. A total of 6,067,788 human cases of COVID-19 have been found in the United States. Other estimates have placed the number at 1.1 to 1.2 million. The number of people who died by suicide in 2017, for example, in the United States, was roughly 47,000. Estimates of the mental health toll of the Great Recession, roughly from 2007 to 2009, in the United States are mixed. A 2014 study tied over 10,000 suicides in Europe and North America to the financial crisis. While the rate of suicide was increasing in the United States, according to an analysis in 2017, the increase could not be directly tied to the recession and was attributable to broader socioeconomic conditions predating the downturn. Multiple times, Donald Trump told the following lie: coronavirus numbers are looking much better, going down almost everywhere, and cases are coming way down. Coronavirus cases are either increasing or plateauing in the majority of US states. On average, the country's positive test rate is lower than it was in March and April. However, those numbers obscure the situation in more than a dozen states where, as of this writing on May the 27th, so 3 months ago, cases are still increasing. Then on Wednesday, June the 17th, 2020, excuse me, Donald Trump made the following claim: "The pandemic is fading away, it's going to fade away," ahead of his rally in Tulsa, Oklahoma, when the United States was still seeing at least 20,000 new daily cases and a second spike in infections was starting. Then on July the 2nd, 2020, Donald Trump claimed the pandemic is getting under control. The country's daily cases doubled to about 50,000, a higher daily case count than seen at the start of the pandemic, and the number was continuing to rise, fueled by infections in southern and western United States. On July the 4th, 2020, the 244th anniversary of the publication of the US Declaration of Independence, 99% of COVID-19 cases are totally harmless. While it is true that currently 99% of the active COVID cases are mild, nevertheless, Dr. Fauci has rejected Trump's claim, saying the evidence shows that the virus can make people seriously ill even if they recover. And the World Health Organization has said that about 15%, so about 1/7 of COVID-19 cases can be severe, and 5%, so about 1 in 20, are critical. On July the 6th, he claimed, "We now have the lowest fatality or mortality rate in the world. The truth is that the US has neither the lowest mortality rate nor the lowest case fatality rate. As of July the 13th, so 1.5 months ago, the case fatality rate, the ratio of deaths per confirmed COVID-19 cases, was 4.1%, which placed the US solidly in the middle of global rankings. The US has the world's 9th worst mortality rate, with 41.33 deaths per 100,000 people, according to Johns Hopkins University." Multiple times, Donald Trump blamed Mexico partly for COVID-19 surges in southwestern United States, which borders on Mexico. The truth is that even before Latin America's COVID-19 cases began to rise, the US and Mexico had jointly agreed in March 2020 to restrict non-essential land travel between the two countries, and US Customs and Border Protection says illegal border crossings are down compared with 2019. Health experts say blaming Mexican immigrants for surges is misguided, especially when most of the individuals crossing the border are US citizens who live nearby. Multiple times, Donald Trump has claimed that children are virtually immune to COVID-19. While the scientific community disagrees among its own members on this claim, this certainly does not mean that children are immune. Studies in the US and China have suggested that children are less likely than adults to be infected and more likely to have mild symptoms. However, they can still spread the virus to their family members and others. The Center for Disease Control, or CDC, has said that about 7% of COVID-19 cases and under 0.1% of COVID-19 related deaths have occurred in children. Then Barack Obama on March the 4th, 2020 blamed the Obama administration, claiming that the Obama administration had made a decision on testing that turned out to be very detrimental to what we are doing. The truth is that the Obama administration drafted but never implemented changes to rules that regulate laboratory tests run by states. Trump's policy change relaxed a Food and Drug Administration requirement that would have forced private labs to wait for FDA authorization to conduct their own non-CDC approved coronavirus tests. On Friday, March the 13th, 2020, Donald Trump falsely claimed that the Obama White House's response to the so-called swine flu pandemic roughly from 2009 to 2011 or 2010 was a full-scale disaster with thousands dying and nothing meaningful done to fix the testing problem until now. The fact is that only something like 17,000 people died of that pandemic in the United States before the numbers went down so radically that it became a typical seasonal flu pandemic. And now we have over 185,000 deaths and counting in the United States. So which administration has had a disastrous response to a pandemic? Barack Obama declared a public health emergency 2 weeks after the first US cases of the swine flu or H1N1 were reported in California. Trump, by contrast, declared a national emergency over 7 weeks after the first US COVID-19 case was reported in Washington state. While testing is a problem now, it wasn't back in 2009. The challenge then was vaccine development. Production was delayed and the vaccine wasn't distributed until the outbreak was clearly waning. Multiple times, the Trump White House has claimed that it inherited a broken, bad, and obsolete test for the coronavirus. The truth is that the novel coronavirus did not exist in humans during the Obama administration. The earliest possible date for it, according to some satellite footage, started to occur in Wuhan, China in August 2019, so 2.5 years after Obama had left the White House as president. Public health experts agree that because of that fact, the CDC could not have produced a test, and thus a new test had to be developed in 2020. Multiple times, Trump has claimed that the Obama administration left him bare and empty shelves of medical supplies in the national strength strategic stockpile. This is a mixture of truth and lie. The 2009 H1N1 or swine flu outbreak did deplete the N95 mask supply and was never replenished. However, the Obama administration did not have the stockpile empty of other materials. While the stockpile has never been funded at the level some experts have requested, its former director said in 2019, before the coronavirus pandemic, that it was well equipped. The outbreak has since eaten away at its reserves. On May the 10th, 2020, Trump claimed, referring to criticism of his administration's response on Twitter, compare that to the Obama/Sleepy Joe, meaning Vice President Biden, disaster known as H1N1 swine flu. Poor Marx didn't have a clue. The truth is that it is misleading to compare COVID-19 to H1N1 and to call the Obama administration's response a disaster. Peter Nicholas, a fellow journalist, has suggested or reported that in 2009 the CDC quickly flagged the new flu strain in California and began releasing anti-flu drugs from the national stockpile 2 weeks later. A vaccine was available in 6 months. Trump later attacked Joe Biden's handling of the H1N1 swine flu. The truth is that Biden was not responsible for the federal government's response to the H1N1 outbreak, as Nicholas has also explained. On March the 6th and May the 11th, Trump claimed, anybody that needs a test gets a test. They are there. They have the tests, and the tests are beautiful, and if someone wants to be tested right now, they'll be able to be tested. The truth is that Trump made these two claims 2 months apart, but the truth is still the same. The US does not have enough testing. In a televised speech from the Oval Office in the White House, Washington, D.C. on March the 11th, Trump said that private health insurance companies had agreed to waive all co-payments for coronavirus treatments, extend insurance coverage to these treatments, and to prevent surprise medical billing. The truth is that insurers agreed only to absorb the cost of coronavirus testing, waiving co-pays and deductibles for getting the test. The federal government has not required insurance companies to cover follow-up treatments, though some providers announced in late March that they will pay for treatments. And as for surprise medical billing, mitigating it would require the cooperation of insurers, doctors, and hospitals. On March the 13th, he made the claim that Google engineers were building a website to help Americans determine whether they need testing for the coronavirus and to direct them to their nearest testing site. The truth is that the announcement was news to Google itself. The website that Trump and other administration officials described was actually being built by Verily, Verily, a division of Alphabet, the parent company of Google. Since then, Google has pivoted to fulfill Trump's public proclamation, saying it would speed up the development of a new separate website while Verily worked on finishing its project, according to the Washington Post. On March the 24th and 25th, Trump claimed that the United States had outpaced South Korea's COVID-19 testing. We're going up proportionally very rapidly, Trump said during a Fox News town hall. Fox News is Trump's favorite TV channel, strongly pro-Republican TV channel in the United States. The truth is that when Trump made this claim, testing in the US was severely lagging behind that in South Korea. As of March the 25th, 2020, South Korea had conducted about 5 times as many tests as a proportion of its population, which is over 51 million, compared to over 331 million in the US, relative to the United States. For updated data from each country, see the COVID-19 tracking project and the database maintained by the Korea Centers for Disease Control and Prevention. On May the 11th, Donald Trump claimed that the United States had developed a testing capacity unmatched and unrivaled anywhere in the world, and it was not even close. The truth is that the United States is still not testing enough people and is lagging behind the testing and tracing capabilities that other countries have developed. The president's testing czar, Brett Giroir, and Dr. Fauci confirmed in a Senate hearing on May the 12th that the US won't be able to perform 50 million tests about what the US needs to safely reopen until the fall. So roughly September to November 2020. Another claim, the United States has conducted more testing than all other countries together. The truth is that by May the 18th, when Trump last made this claim, the US had conducted more tests than any other country. However, as of May the 27th, and even later, the rest of the world has conducted more tests combined than the US. Multiple times, including 1 month ago in a tense televised interview by an Australian television journalist, Jonathan Swan, Trump continued to claim that the cases are going up so quickly in the United States because the United States is testing more people than any other country, or actually far more. The truth is that the COVID-19 cases are not rising because of the US big number testing. Outside the Northeast, so roughly the mid-Atlantic states and New England, the share of tests conducted that come back positive is increasing, with the sharpest spike happening in southern states. In some states, such as Arizona in the southwest and Florida in the southeast, the number of new cases being reported is outpacing any increase in the state's testing ability. And the states set new daily case records and report increasing hospitalizations. All signs point to a worsening crisis. On March the 11th, 2020, Trump made the following claim. The United States would suspend all travel from Europe except the United Kingdom, meaning Great Britain, Northern Ireland, for the next 30 days. The truth is that the travel restriction would not apply to US citizens, legal permanent residents, or their families returning from Europe. At first, it applied specifically to the 26 European countries that make up the officially passport-free Schengen area, not all of Europe. Later, Trump announced the inclusion of Britain and Ireland in the ban. Another claim in the same address on the US television on March the 12th, 2020, Trump said the travel restrictions would not only apply to the tremendous amount of trade and cargo, but various other things as we get approval. The truth is that he sent a follow-up message on Twitter explaining that trade and cargo would not be subject to the restrictions, so he contradicted himself. On March the 12th, he made the claim that all US citizens arriving from Europe would be subject to medical screening, COVID-19 testing, and quarantine if necessary. The truth is that testing is already severely limited in the US. It is not true that all Americans returning to the US are being tested, nor that anyone is being forced to quarantine, according to CNN. On March the 31st, so almost exactly 5 months ago, he claimed that the US stopped all of Europe with a travel ban. The truth is that the travel ban applied to the Schengen area. There are at least 19 other countries in Europe, as well as Britain and Ireland, and Britain had left the European Union 2 months earlier on January the 31st, 2020. Additionally, Trump is wrong about the United States rolling out a piecemeal ban. The State Department did issue advisories in late February, cautioning Americans against travel to the Lombardy region of Italy before issuing a general do not travel warning on March the 19th. But the US never placed individual bans on Italy and Spain. Multiple times, Donald Trump has made the following claim: everybody thought I was wrong about implementing restrictions on travelers from China, and most people felt they should not close it down, that we shouldn't close down to China. The truth is that while the World Health Organization, did say it opposed travel bans on China generally, Trump's own top health officials have made it clear that the travel ban was the uniform recommendation of the Department of Health and Human Services. Dr. Fauci and Deborah Birx, the coordinator of the coronavirus task force, both praised the decision too. Multiple times, the Trump administration's travel restrictions on China, according to Trump, were a ban that closed up the entire United States and kept China out. The truth is that nearly 40,000 people traveled from China to the United States from February the 2nd, when Trump's travel restrictions went into effect, to April the 4th, so for those 2 months, according to the New York Times. Those rules also do not apply to all people. American citizens, green card holders, so those who have a permanent immigrant visa, and their relatives and people on flights coming from Macau and Hong Kong are not included in the ban. On taking the pandemic seriously, one of the most ridiculous lies that he has told. On Tuesday, March the 17th, 2020, I've always known this is a pandemic. I felt it was a pandemic long before it was called a pandemic. I've always viewed it as very serious. The truth is that in one campaign rally, re-election campaign rally in February 2020, he called it a hoax. And he called it as late as in June 2020, in two election campaign rallies, Kung Flu, a word play on Kung Fu. And he was warned at least a few or some, maybe even several times before he finally agreed on the last days of January 2020 to announce the partial travel ban from China. So he had definitely been warned, and for over 7 weeks, counting from the first domestic or US COVID-19 case, he took no effective action. From calling criticism of his handling of the virus a hoax to comparing the coronavirus to a common flu, echoing maybe the right-wing radio commentator Rush Limbaugh, who now has a life-threatening cancer, to worrying about letting sick Americans off cruise ships because they would increase the number of confirmed cases, Trump has used his public statements to send mixed messages and sow doubt about the outbreak seriousness, and also his irresponsible tweets, liberate Michigan and so forth, I think in April 2020. On March the 26th, 2020, he claimed this kind of pandemic was something nobody thought could happen. Nobody would ever have thought a thing like this could have happened. The truth is that experts both inside and outside the US federal government sounded the alarm many times in the past decade about the potential for a devastating global pandemic, according to journalist Yuri Friedman. 2 years ago, Ed Yong, another journalist, explored the legacy of Ebola outbreaks, including the devastating 2014 epidemic, which was restricted mostly to Africa, to evaluate how ready the US was for a pandemic. Ebola hardly impacted the United States, but it revealed how unprepared the country was. On COVID-19 treatments and vaccines, on March the 2nd, 2020, he claimed pharmaceutical companies were going to have vaccines, I think, relatively soon. The truth is that his own experts told him during a White House meeting with pharmaceutical leaders earlier that same day that a vaccine could take between 1 and 1.5 years to develop. In response, he said he would prefer if it took only a few months. He later claimed at a campaign rally in Charlotte, North Carolina, that a vaccine would be ready soon. On March the 19th, 2020, at a press briefing with his coronavirus task force, he said the Food and Drug Administration had approved the anti-malarial drug chloroquine to treat COVID-19. The truth is that the Food and Drug Administration Commissioner Stephen Hahn, who was at the briefing, quickly clarified that the drug still had to be tested in a clinical setting. A Food and Drug Administration representative later told Bloomberg, a business magazine, that the drug has not been approved for COVID-19 use, though a doctor could still prescribe it for that purpose. Later that same day, Dr. Fauci told CNN that there is no magic drug to cure COVID-19. On April the 24th, 2020, Trump was being sarcastic when he suggested in a briefing on April the 23rd that his medical experts should research the use of powerful light and injected disinfectants to treat COVID-19. Actually, Trump's tone did not seem sarcastic when he made the apparent suggestion to inject disinfectants. Turning to Birx and the Department of Homeland Security Science and Technology official, he mused, "I see the disinfectant where it knocks it out in a minute, 1 minute. And is there a way we can do something like that by injection inside or almost a cleaning? It would be interesting to check that." When he walked the statement back the next day, he added that he was only asking his experts to look into whether or not sun and disinfectant on the hands work. On May the 8th, 2020, he claimed that the coronavirus was going to go away without a vaccine and that we were not going to see it again, hopefully after a period of time. Dr. Fauci has actually repeatedly said, including during a Senate hearing on May the 12th, 4 days later, that the coronavirus's sudden disappearance is just not going to happen. Until the US has a scientifically sound, safe, and effective vaccine, Dr. Fauci said, I think in July 2020, the pandemic will not be over. Multiple times, Trump has made the claim that taking hydroxychloroquine to treat COVID-19 is safe and effective. The truth is that his own Food and Drug Administration has warned against taking the anti-malarial drug with or without the antibiotic azithromycin or azithromycin, which Trump has also promoted. Several large observational studies in New York, France, and China have concluded that the drug has no benefit for COVID-19 patients, and Dr. Fauci and Trump's own testing czar, Brett Giroir, have also cautioned against it, as the president has repeated this claim in recent months. Another claim that he has made is that one bad study from the Department of Veterans Affairs that found no benefit among veterans who took hydroxychloroquine to treat COVID-19 was run by people who were not big Trump fans. The study was a Trump enemy statement. The truth is that there's no evidence that the study was a political plot orchestrated by Trump opponents or that it reached similar conclusions and it actually reached similar conclusions as other observational reports. The Veterans Affairs study was led by independent researchers from the University of Virginia and the University of South Carolina with a grant from the National Institutes of Health. He has also claimed that many frontline doctors and workers are taking hydroxychloroquine to prevent COVID-19. The truth is that there are no conclusive numbers for how many workers are taking the drug outside of the study's multiple trials that are underway to determine if healthcare workers should take the drug as a preventative. On August the 6th, 2020, he claimed that a coronavirus vaccine could be ready by election day, so 3 months later. The truth is that the timeline Trump proposes contradicts health experts' consensus view that early 2021 is likely the earliest time when a vaccine could be approved. On the Defense Production Act, on March the 20th, 2020, he twice said during a task force briefing that he had invoked the Defense Production Act, a Korean War-era law that enables the federal government to order private industry to produce certain items and materials for national use. He also claimed that the federal government has a lot of people working very hard to do ventilators and various other things. The truth is that on March the 22nd, in an interview by the CNN, the Federal Emergency Management Agency Administrator Peter Gaynor said that the president had not actually used the DPA to order private companies to produce anything. Shortly after that, Trump backtracked, saying that he had not compelled private companies to take action. Then on March the 24th, Gaynor told CNN that FEMA plans to use the DPA to allocate 60,000 test kits. Trump tweeted afterward that the DPA would not be used. On March the 21st, he made the claim that automobile companies that have volunteered to manufacture medical equipment, such as ventilators, were making them right now, or right then. The truth is that Ford and General Motors, which Trump mentioned at a task force briefing the same day, announced earlier in March that they had halted all factory production in North America and were likely months away from beginning production of ventilators, representatives told the Associated Press. Since then, Ford CEO James Hackett told CNN that the auto company would begin to work with 3M to produce respirators and with General Electric to assemble ventilators. GM said it would explore the possibility of producing ventilators in an Indiana factory. Tesla CEO Elon Musk, whose company Trump highlighted in a tweet, has said that the company is working on ventilators, but that they cannot be produced instantly. On March the 24th, he made the claim that Governor Andrew Cuomo of New York passed on an opportunity to purchase 16,000 ventilators at a low cost in 2015. He made this claim during the Fox News town hall. The truth is that Trump seems to have gleaned this claim from a Gateway Pundit article. That piece in turn cites a syndicated column from Betsy McCaughey, a former lieutenant governor of New York, which includes a figure close to 16,000. The report does not include a recommendation to Cuomo for additional purchases or stockpiling. Trump obviously didn't read the document he's citing, a Cuomo representative said in a statement. In another claim, he also repeated that from the great Gateway Pundit article, he claimed that the Cuomo's office established death panels and lotteries as part of the state's pandemic response. The truth is that the 2015 report and the accompanying press release announced updated guidelines for hospitals to follow to allocate ventilators. The guidelines called for a triage officer or triage committee to determine who receives or continues to receive ventilator therapy and describes how a random lottery allocation might work. Neither should be the first options for deciding care, the report notes. Cuomo never established a lottery. On March the 29th, 2020, he claimed that he hadn't said that governors do not need all the medical equipment they are requesting from the federal government, and he denied saying that governors should be more appreciative of the help. The truth is that he told Fox News' Sean Hannity, one of his chief defenders, on Thursday, March the 26th, that a lot of equipment is being asked for that I don't think they'll need, referring to requests from the governors of Michigan, New York, and Washington. He also said during a task force briefing on March the 27th that he wanted state leaders to be appreciative. We've done a great job. He added that he wasn't talking about himself, but about others within the federal government working to combat or fight against the pandemic. On March the 29th and 30th, 2020, he claimed that hospitals were reporting an artificially inflated need for masks and equipment, items that might be going out the back door. He also said that he was not talking about hoarding. I think maybe it's worse than hoarding. The truth is that there is no evidence to show that hospitals are maliciously or with an evil intent hoarding or inflating their need for masks and personal protective equipment when reporting shortages in supplies. Although Cuomo reported anecdotal stories, in other words, stories based on unconfirmed stories of theft from hospitals early in March, he was referring to opportunists trying to price gouge early in the pandemic so they wouldn't have to spend so much money on the masks and other personal protective equipment. Reuters has reported a handful of stories of nurses hiding masks to conserve supplies amid shortages, but not wide-scale thefts, as Trump claimed. On April the 14th, 2020, asked about his past praise of China and its transparency, Trump said that he hadn't talked about China's transparency. The truth is that in tweets he sent in late January and early February 2020, he had praised China. In one, he had highlighted the Chinese government's transparency about the coronavirus outbreak. On May the 29th, 2020, he claimed that the World Health Organization had ignored credible reports of the coronavirus spread in Wuhan, the Chinese city that first reported the new virus, including those published in the Lancet Medical Journal in December 2019. The truth is that the Lancet said it did not publish such reports in December. Its first reports of the virus spread in Wuhan were published on January the 24th, 2020. In another claim, Trump claimed that Taiwanese officials had warned the World Health Organization about human-to-human transmission of a new virus by December the 31st, 2019. The truth is that Taiwan did not cite human-to-human transmission in the communications Trump referenced, but it did ask for more information and compared the virus to SARS that killed thousands of people in the early 2000s. In another claim in mid-January, he claimed that the World Health Organization had said the coronavirus could not be transmitted between humans. The truth is that the World Health Organization said on January the 12th that early investigations by China could find no clear evidence of human-to-human transmission in Wuhan, but it did not rule such transmission out. On January the 14th, an official of the World Health Organization said during a press conference that it is possible that there is limited human-to-human transmission among families and warned hospitals around the world to prepare for a greater outbreak. Multiple times, he claimed that the House Speaker, Nancy Pelosi, a Democrat, urged people to attend parties and a parade in San Francisco's Chinatown to show that this thing doesn't exist. The truth is that Pelosi did visit San Francisco's Chinatown in late February to encourage residents not to fear the coronavirus in the city. Precautions have been taken and the city was on top of the situation, she said. But she did not urge people to attend a parade or parties. San Francisco reported its first case of COVID-19 on March the 5th, a week later, and the Bay Area ordered residents to shelter in place 3 weeks after the speaker's visit. In another claim, Trump falsely accused Pelosi of dancing in the streets of Chinatown, trying to say it's okay to come to the United States, it's fine, it's wonderful, come on in, bring your infection with you. The truth is that Trump, in that claim made in May 2020, was embellishing his original lie. Pelosi was not dancing in Chinatown or urging sick people to bring the coronavirus to the US. On April the 19th and April the 21st, he claimed that protesters who gathered in a handful of states over the weekend to oppose social distancing were doing social distancing themselves and were all 6 feet apart. The truth is that protesters had clogged or basically closed streets in at least 7 states after an April 15th demonstration at the Michigan State Capitol grabbed national attention. In California, Colorado, Maryland, North Carolina, Pennsylvania, and Virginia, demonstrators did not seem to be following the CDC's safety guidelines. Local news outlets reported, and photos and videos from the ground showed tightly packed protests. The final claim: racial justice protests and demonstrators fueled a surge in coronavirus cases. There is actually no evidence to support Trump's claim, though epidemiologists did fear at first that protests would trigger more infections. A recent study by Northeastern, Harvard, and Northwestern universities suggests that widespread mask wearing and the outdoor nature of the protests mitigated or lessened the spread, or slowed it down. Some economists have argued that the protests in over 300 US cities might have actually encouraged more Americans to stay at home during the civil unrest. So judge for yourself whether Donald Trump is a reliable leader on this issue, for example.